Karlie Intlekofer with Matrix Fitness and Trio Wellness. Today we're going to talk about the intersection of exercise and COVID-19 and cover three top questions that are common about this. At this point, it's February 2022. COVID cases and rates of hospitalization are finally beginning to drop within the US. And at this point, most of us have already contracted the virus or gotten vaccinated. So today I'd like to touch on these common questions as well as the issue of COVID long haulers. So let's get started. We know that severe COVID has a top risk factor of age. So the older you are, the worse clinical outcomes on average. It's also most dangerous for those who have other chronic conditions like heart disease, cancer, type 2 diabetes, and so on. We know that the higher the BMI or the body mass index, the higher the risk of complications as well. This actually is a bigger deal for those who have a high BMI due to excess body fat. You can have an elevated BMI due to excess muscle mass, but that is not what we're talking about here. In fact, it seems to be related to having a larger waistline more than anything else. And there's a couple reasons for this. The first reason is that the coronavirus spike protein might have a higher impact on those who have more visceral body fat or fat around the waist, because those fat cells around the waist have a lot of receptors for the COVID spike protein. Secondly, we know that as waist size increases, typically people are more inflamed. They have more systemic inflammation. And so their immune function may be impaired because of this, and or the combination of that plus high blood sugar. Again, more common in those who have a higher BMI due to a larger waistline. Now, these golden arrows here are showcasing that exercise can help at a lot of these different points. Of course, it can help address a high BMI due to excess body fat, and it can help you reduce that waist size. It can reduce inflammation, and it can also help you cope with blood sugar roller coaster that a lot of us are on. So let's get into the three questions that are pretty common based on exercise and COVID. The first being, how does exercise affect the risk of COVID? Now, there have been several papers that have come out in the last 2 years on this topic. For example, there's a very nice larger scale study in the US on over 48,000 adults with COVID. And what it found is that sedentary individuals have more long-term COVID-19 complications than do active individuals. Similar to this, there was a study out of Brazil that also showed that individuals in the higher levels of fitness were less likely to suffer complications or be hospitalized compared to those who are in the lowest rates of physical activity, lowest levels of fitness. We can see that this screenshot from a peer-reviewed paper shows that link between inflammation and the clinical outcome. Again, exercise can help us manage inflammation, especially with smart exercise programming. And then secondly, this paper here showing that your maximal exercise capacity or your fitness is inversely related to risk of hospitalization and the secondary risks of COVID that we know are particularly serious. All of this pointing in the direction that exercise benefits you and reduces your risk of COVID. So if you do get it, your symptoms are more mild and you're less likely to get it. If you do test positive, moving on to question 2, can you exercise? When it comes down to the guidance here, please keep in mind it's just reviewing what the research is saying. You should be making these decisions with the help of a medical team or your medical care providers, so they can base it off of your personal history, your specific situation, etc. But if you look at the research, just from an educational standpoint, the research is saying, yes, if you are fever-free and you're feeling okay, then yes, you can exercise. Take steps to not spread the virus if you're still contagious, but exercise is a good choice. In fact, with many respiratory viruses, we see better outcomes, including less symptomatic days, when folks engage in mild to moderate exercise. Nothing lasting longer than 45 minutes, according to the research, but instead shorter, lighter workouts to just help get that blood flowing, because of course that's a part of the healing process. As your symptoms resolve, that should guide you to return to your typical levels of activity here. And just as an aside here, I like to look at the primary research as well as some reviews. This is a Cochrane library review. These tend to be more conservative with their conclusions. And this one is also showing, as you can see in the purple text, that exercise may reduce days of illness and ease symptoms. Now, the caveat here is that this review is based on general guidance for viral infections that are affecting us right now and not specific to COVID. So we may find out more as more research continues to be generated. Now, what if recovery doesn't go as planned? And my third question addresses the long haulers. These are folks whose symptoms are persistent. These are symptoms that last at least 4 weeks. And it's a very frustrating and difficult process for millions of Americans right now. We know that the COVID long haulers, we tend to have more issues for these folks if they were hospitalized, but you can still have long haul symptoms even if you weren't hospitalized, even if you were mildly symptomatic to asymptomatic, which is a shocker. We see that about 30% of those who are hospitalized with COVID have some level of myocarditis or inflammation of the heart muscle. This we think will resolve, but it seems to take some time. There's also evidence of brain damage and brain inflammation. This can result in a pretty common experience. Again, around 34% of folks will say that they have some symptoms of brain fog. This means a little bit of perhaps confusion, maybe just not thinking as clearly, difficulty focusing, learning, and remembering things. So it can be a real problem, especially if your job relies on clear thinking and your family relies on you to get a lot of things done that require your brain, of course. Most folks who have COVID reported having headaches as well, and some people's headaches last. They end up having headaches for months. One of the most common symptoms 6 months later, though, is fatigue and exercise intolerance. This doesn't just mean they don't like to work out. This means that going up the stairs can cause rapid spikes in heart rate. It can feel like you're having a panic attack just to do something that's mildly strenuous. Maybe going grocery shopping is exhausting. This is very severe, and unfortunately, there's no magic pill to help us come out of this exercise intolerance. It really depends on what you do to recover. So how common are long haulers? They're very common. We think that it's about 10% of all of those infected with COVID, whether they're hospitalized or not. And it's about 80% of all those hospitalized with COVID. If you're hospitalized, it's a more severe form of COVID, you have more severe symptoms, and those are the folks who still are having symptoms after 6 months. So kind of scary stuff here. There is light at the end of the tunnel, but the problem is the process is really frustrating, and it's not just an inconvenience, it's a mental health issue. As some of the long haulers say, quote, "I feel like I've lost myself. I'm not the same as before." This can be particularly damaging to folks who saw themselves as athletes or as super active, and suddenly they can't do the things that brought them stress relief, that brought them joy, that made them feel like they had a sense of identity. Another quote here: "My life is on hold right now because I'm exhausted every day." You might feel this way even if you're not a long hauler, because there has been a lot of mental health issues and fatigue related to pandemic stress. So this isn't just the former athletes, the former athletic folks. Of course, this is affecting every level of society, and it's particularly difficult for those who have manual labor jobs, who may be dealing with grief or stress related to other losses in their lives, and especially for parents. Parents, of course, are dealing with a number of complications. It's beyond the scope of this presentation, but I think we can all appreciate a lot of folks could use a gentle approach to getting back into exercise. Now, what am I talking about? Why did I pivot straight to exercise? Because the third question is, if you are a long hauler, should you exercise? And again, this is educational material from the research. The answer appears to be yes, but your progress should reflect your symptoms. That also includes your health history and your perceived exertion levels, meaning if you do a workout and it's a relatively easy workout, how are you recovering? If it's taking you a really long time to recover, if it's extremely exhausting, then this may be something to consider as you plan the rest of your week for what kind of level of workout you want to do. Warm-ups really do matter here. If your heart is still inflamed, if your lungs are still inflamed, your cardiovascular system is going to take longer to ramp up to the intensity. So please do a gradual, slow warm-up. And if you feel any symptoms that feel severe in any way, shortness of breath, etc., make sure you're following physician guidance. And then short workouts do work. I put this in here because if you're used to doing a really long, difficult workouts, it's hard to set your ego aside when you return to a workout that's much shorter and easier overall. So, but they do work. So definitely don't skip the workout, even if it's a short one. So what about this topic of exercise, this golden phrase to someone like myself? You should know that we don't have a pill that mimics it at this time. It is simply not possible to regain fitness and strength without exercise. We know that exercise improves mental health. I'm a neuroscientist by training, so this point is really important if you ask me. And it also benefits our ability to focus and learn. So we need to use energy throughout our body in order to produce more energy. This has to do with the mitochondria for those exercise science folks out there. But the point is, if you want to escape the feeling of fatigue every day, you actually have to put some effort in, even if it's in short bursts, short exercise sessions rather than long workouts. Now, when it comes to folks who are recreationally active, there has been a paper that's specifically on that population that said that if you're asymptomatic for a week, then you can resume physical activity at about 50% of your average intensity and volume. And that comes from this paper by Metzel and colleagues published just recently. Now, I do want to mention the issue of lung damage. A lot of folks with COVID have it. In this image, you can see anything in red is showing lung damage. I've shared this slide a couple times because I think it's impactful. What you can see is that after 6 weeks, after 12 weeks, there's still a lot of lung damage around. So you may need to be patient with yourself as you get back on the horse and start exercising more. And this quote I thought was impactful. It's by Dr. Karlie Intlekofer, who's at Johns Hopkins. He says, "I always tell patients there is no medication to make your lungs stronger. The only way to make them stronger is by using them. Every time you exercise, more blood flow gets to the lungs, and more blood flow means more healing cells will come to heal the parts that are damaged." Again, not my words, medical doctor trying to advise his patients and encourage them to exercise. I think it's quite impactful. So at the end of the day, the real question is, should you exercise? And generally speaking, with very few exceptions, the answer is yes, you should try to. And I've included some of my references I've pulled most strongly from here, and certainly happy to discuss these if you want to contact me personally on LinkedIn or otherwise. So today, in summary, we covered how does exercise affect the risk of COVID? The answer is it reduces the severity of symptoms, probably, and it's a benefit to you to aid your recovery. Number two, we asked if you test positive, should you exercise? And again, the studies say yes, but follow your medical guidance and follow your symptoms to really determine how to get back into it. Short workouts work, try to keep that habit going. And then last but not least, if you're a long hauler, should you exercise? Of course, the symptoms matter here. Medical guidance is important, but exercise may be the most important thing you can do for successful recovery. So I want to thank you for joining me today, and everyone at Hidden Gym, Matrix Fitness, and Trio Wellness, wishing you a great day and hopefully a great workout.